Welcome, everybody, to this month's National Equine Conference call. We have a very tight agenda, so I'm going to just go forward and give a few brief remarks to start with. Again, thank you for everybody who has provided topics and suggestions. We seem to have had a lot this month, and luckily, we have a full agenda. And just a couple things to call to your attention. We do not have a screwworm update formally, so I did put in the agenda a link to the USDA screwworm webpage, which has the latest information. And I would also call your attention to their graph of the location, or excuse me, their chart of locations for the recent detections of screwworm in Mexico. Still no detections in the United States. I would also call your attention to the FDA and their recent announcements as far as emergency use authorization approvals that have been given, as well as conditional licenses for products. As far as the emergency use authorization, there has been a couple topical products that have horse approvals. So I would call your attention to that. And then I would also call your attention to the USDA's website for the latest vesicular stomatitis situation report. Unfortunately, we did have a declaration of Colorado having a case. That was reported on Friday of last week, and that situation report is on the USDA website. So I would call that to your attention for the latest information on both vesicular stomatitis and New World screwworm. At this time, I am going to stop sharing the screen. Give me a second. And I'm going to turn it over to our Dr. Lutz Goring out of the University of Kentucky Gluck Equine Research Center. And it's a very timely presentation, considering it was in the news yesterday in the USHA news about the air sampling and detections. And I'm really happy to say that I was right in saying that EHV is there in the environment and it's here to stay. So we just need to understand it. And to give us more information on the air sampling project, I will turn it over to Dr. Goring.
Thanks very much, Katie. Pleasure to spend some time here on on the site and present some of the data. And of course, this was initiated. This was a study initiated by the FEI. Actually, they were interested in looking.
Dr.
Yes,
Goring, did you want to share your screen?
I thought I did. Okay.
Nope, I'm not seeing
Okay.
it.
Okay.
Sorry to interrupt. I just wanted to
No
make
worries, no
sure.
worries. It's another. So probably have to start with this one here, right? We share this one. Is the activity now?
Yep, it's not presentation mode though. It's your
Yeah.
okay. Yes, now we're perfect. Thank you.
Okay. Very good. Sorry for this. This was a project where we were joining forces together with the FEI. They were interested in looking into group surveillance using air during equestrian events, very similar to we all remember that the COVID detection in wastewater assessment, so a group surveillance tool using air going away from individual sampling, nasal swab sampling of horses, or environmental swabs reduction, looking if we can use air as a group surveillance tool to follow up on this. And the reason, of course, is the FEI wants to have grip on. Everything is good with with the sound and everything. Katie, right?
Apparently he confirmed.
Yes, go ahead. Lutz, you're muted. I had to mute everybody, so please unmute. Apologies.
Okay. So where do I start again here, or did we get the beginning?
Nope,
You
you're
got the
good right
beginning,
there,
right?
sir. You're
Okay.
good right there. Thank you.
Okay, so and the reason for the FEI to step in, of course, are the number of outbreaks with EHM at equestrian events. Ogden, Valencia, Thermal, Oliva, Nova, and the latest one in the books, Waco, Texas, just with this Christmas. Latency is a problem because latency is probably the answer to this problem. We have horses that carry virus with them, and especially with we see reactivation and reappearance of virus in the respiratory tracts of horses with commingling events and with transportation. We believe these are either a small number of horses that reactivate, but they certainly can contribute to transmission into neighboring horses at these events, and we would see disease propagation during events. We got the advice from the vaccine industry actually to use this kind of device here. It's a Coriolis compact air sampler from a company in France, Bertin Technologies. It's a sampler with a capacity of 50 liters per minute of air sampled with this device. It's an impressive amount of air. However, it's not top capacity. It uses these exchangeable cups that are kind of placed here in the holder of the equipment. It aspirates air and it accelerates it so that it spins in a cyclone down in this little sampling cup here. By the end of your sampling period, you exchange the cup and you're done with your sampling. To show you this in action, here we are looking into a barn aisle at an event. We place the sampler in an empty stall at 150 meters height. Can hear the sound, maybe. The other thing I wanted to show you here is actually the environments, which were highly different between the studies. The environment here we encountered during this show. You see it's all open here. By the way, there's pouring rain down here. The wind was blowing up and down the aisles, left and right. And these were the conditions, and I was 100% sure we would never ever find a single virus virion here in these environments. But I will show you the results just in a little moment. For comparison, as a reference, we used surface swabs from surface samples. We chose an area between two bars here at the sliding gate entrance of a horse stall. In a later study, we had access to nasal wipes that were collected separately, and we had access to compare our air samples with this. I will show you in a little bit. Just as a marker of costs, this device, so the device itself, the hardware itself is about $10,000, and each sampling cup runs with about $20 a pop, and you can buy sterile, individually packaged sampling cones for, I think, $29 or $30 a piece, just to give you a benchmark for costs for this technique. We went into several events at two events in the United States, one in Florida, one in Kentucky, this one in September, this one in December, and we went to four different events in Spain. What you see here is per event the number of sampling days represented in a row. A row would also represent a sampling area, so an aisle with stalls left and right, to a sampling aisle represented here in 10 individual squares. This was the area we sampled. An X would mark a stall that was not used. in the future representation. Each stall has like three different indicators here. We used each of these little squares in an individual stall for giving the qualitative results, whether we detected EHV2, EHV1, or EHV4 in a surface sample. And here in the columns to the very right, we show the air sample results for EHV2, EHV1, and EHV4. We were always asked, why did you sample for EHV2? That was our marker virus in case we would not have sampled anything else. We were pretty sure we would, at least as a marker of that our system works and our sampling techniques would work. We used EHV2 on these occasions. The air sampling went on a standardized sampling tour. Here, 50 liters of air per minute. That was the maximum capacity of the equipment. We sampled for 6 hours, and the results are presented in genome copy numbers of virus per cubic meter of air sampled. These are the results for the event studies. And as you can quickly eyeball, we have a lot of red representing EHV1 copy numbers here on in the first half of the study. Then in the second half, we see more EHV4 coming up on the surface samples, green as we predicted all across the studies. In the columns, we see the air sample results for EHV2, 1, and 4 in copy numbers per cubic meter of air sampled. Quite impressive, actually, and especially if you look at the EHV1 column here, I would like to mark 2 areas, one for EHV1 and one for EHV4, where the counts were easily above detection of 1,000 copies per cubic meter of air. When we had these results greater than 1,000 copy numbers, we usually also had a hotspot here on the surface samples, in one of the surface samples, representing a very high viral copy number load, and also indicating that very likely we had an active sheddar in the vicinity here at these events. We also saw this during the Kentucky show. We saw this for EHV4 at this high copy number here in air. And I just would like to ask you to keep that benchmark of 1,000 in mind if I show you a few other results here of this study. So with this in mind, we also went into the treatment areas of veterinary care facilities. This is a project Emma Hyde, a graduate student here at University of Kentucky, just completed. We went into these equine care facilities and sampled treatment areas. We had a placement of the air sample at the same constellation as during the shows. We had, in addition, we sampled surface areas in areas where nasal secretions are likely to be deposited. So at the stocks where the head of the horse would be in contact with materials of the stocks, or here at cross ties where they prepared horses or where they examined horses or treated horses for various purposes. Results were very, very similar throughout both studies for the back-to-back studies here done in summer and winter. For EHV1 and for EHV4, we had a low-grade detection of EHV1 in air in the mid-hundreds. Same is true with the exception of 2 outliers here for EHV4. Also in mid-hundreds, easy detection of EHV1 or 4 in the air samples. We went furthermore racetrack barns, um, into racetrack barns. And here again, I would like to show you the setup here, not that I want to show you a bunch of people here waiting for things to happen. I want to show you the setup here where we placed the sampler for your understanding of how we came up with this data. This is the row of stalls here, individual stalls in one of the barn buildings. They have a solid ceiling here. They have a solid ceiling here, which is a walkable ceiling. And if you go on top of this slate of ceiling, you actually walk over a quadruplet of stalls. Each stall in the back corner has an air vent, and on top is a ventilation system that switches on every 10 minutes, every hour, I think, for some additional ventilation. So we place the air sampler exactly here in proximity to one of those outlet vents. So we were actually sampling more closely like these 4 areas here, because it is a very open area. Look, you're looking in the outside here. Wind is blowing again back and forth into this area to give you give you an impression of how we sampled this data. The blue dots here on the right side, these are the air sample results from the racetrack study. And again, here, somewhere in the mid-hundreds, we detected on individual sampling days, we detected EHV1 in these circumstances here. Also at this low grade level of detection. What does it mean, this low-grade level of detection? We compared to experimental infections. We have two air sample results from experimental infections, where once daily, according to the same protocol, we sampled and measured either EHV1 or EHV4, depending on the study that was performed. And during the first study here, you can easily see that we are at the higher end of at that 1,000 copies per cubic meter benchmark here, sampling 2 horses behind the air sampling measurements here 4 horses in this central barn aisle here for EHV4. And again, the difference is here, experimental infections, you create a larger cloud of virus here in this environment. And easily you jump that notion of 1,000 copies per cubic meter benchmark for the experimental studies. This gives us an indicator for how to interpret these results. Our main findings here that we had a rather common detection of either EHV1 and or EHV4, depending on the events we usually had copy numbers less than 1,000 copies per cubic meter. And these 1,000 copies per cubic meter, they corresponded with low detection on surfaces in the majority of cases. It is very important where your sampler is located, the proximity very likely to a shedding source, and the sampling environment is very important for your results. In conclusion, I would emphasize that biosecurity remains the most powerful tool in minimizing EHV1 transmission here, interpreting these results, and minimizing direct contacts between horses remains extremely important, despite the fact that we had different backgrounds here in these studies. Minimizing direct contacts between horses with different backgrounds or sharing equipment between them should have the highest priority at events and beyond. Would like to thank a number of people for this and funding sources, but I think I'm a little bit out of time and we have a tight schedule. So would like to conclude this presentation here. Thank you very much.
Dr. Goring, thank you so much. If you have any questions for Dr. Goring, please put them in the chat. Excellent presentation, excellent research. Not just because it does support my biosecurity efforts, but it's something that we have been looking forward to and seeing what the difference is. I just have one really quick question, just for clarification purposes. When you didn't see any EHV1 in the US Kentucky stabling, you saw EHV4. Can you remind us when that sampling occurred? What time of year?
This was the September or August September sampling.
September show season. Yeah. Again, thank you so much. This is really crucial. We are going to take you back on this agenda next month, and you will give us more information on your infection studies, correct?
Yes,
Perfect.
would
Thank
be
you so much. I
very interesting
appreciate
to
it.
do.
I
Thanks very
really
much.
appreciate it. Awesome research. Thank you for your time and efforts. Okay, sorry to be moving us along, but next on our agenda is going to be the NOM study update from Dr. Diana Short, who has taken over the NOM study for USDA. Diana, can you share your, perfect. There you go. I'll turn this over to Diana.
Thank you, Katie. Can everyone hear me okay?
Yep, you're good to go.
Okay, awesome. Hopefully the video will, oh, my face is not going to pop up, maybe. Apologies for that. Maybe it will load here before we're done. So thanks so much for having us on. Really appreciate taking a few minutes time to talk with you about the NOMS study. Very hard to act to follow, I have to say. Awesome presentation. Thanks for sharing the information on the air sampling. That was really cool. And very relevant to our NOM study. So first, as Katie mentioned, I am a veterinary medical officer, large animal veterinarian, and co-leading the equine study with Andrea Beam. Many of you have probably encountered Andrea Beam, worked with her to develop and lead the development of this study. This year, she took on the lead role for the entire NOMS unit. She remains the co-lead on this study and on top of her leadership role. So she is really the keystone of this study. I am doing my best to lead it through its implementation, and I'm grateful to Andrea, the NOMS team, our agency partners, all of you here, and our many stakeholders that continue to show support for this study. So my plan is to give a real quick introduction for those of you that may be hearing about this for the first time today, and then share a bit about where we are and what our timeline looks like. So this is the fourth study that NOMS has conducted in collaboration with the equine industry. I must add another note of thanks to all the farms and equid owners out there that participated in all those studies in the past and who will participate this year. These studies would not be possible without them. Our objectives, sorry for the very dense word slide here, but I wanted to share what we're looking at for these studies and how they were determined. They were determined through needs assessment surveys, focus groups, and also in consultation with industry. You can find all these objectives on our study launch sheet on our website, and I'll show you a link to that at the end. But in a nutshell, the study aims to provide important information about health and management practices on equine farms and the trends of those over time. It's going to take a national in-depth look at the industry's most pressing health issues. Some of those include availability of veterinary and other services, issues surrounding equids at risk or in vocational transition, preparedness for emergencies, and of course, describe biosecurity and health management strategies related to the equine infectious diseases of concern on farms and also at events. So that last objective on the slide, describe prevalence of equine respiratory disease pathogens from environmental samples at equine events, is our last objective that we have attached to phase 2. We'll get to that in the next slide a little bit. So phase 1 is where we are at the moment. And wanted to share that this is what we're calling the farm phase. And it consists of a survey focusing on those objectives that we just touched on in the last slide. This is the phase that we are launching this year. It is being conducted in collaboration with our partners at NASS. It will include all 50 states, and farms with 5 or more equids are eligible to participate. The data collection window for this study has been set for August 1st. So we anticipate all will happen on time, and we will be collecting data at that time. That brings us to phase 2. Phase 2 is currently on hold. However, I wanted to share that it consists of questionnaires, as well as biological sampling that is intended to be conducted at equine events in 30 states. The events studied will represent many breeds, disciplines, and event sizes, and the data from phase 2 are expected to provide information about ways to reduce incidence of infectious disease at events and the important biosecurity measures and disease monitoring to help prevent those. So we will be evaluating our capacity for implementing phase 2 as we designed it this spring in 2027. So please stay tuned for more. We anticipate being able to share more information on this phase once we're able to do that. And so, as many of you know, these studies take a lot of work and effort in their design and development. That's been going on for a number of years. We are in 2026 and are implementing phase 1 data collection August 1st. We'll be analyzing those data and reporting on those data during 2027 and 2028, while also working out how we will, what our capacity will be for phase 2 and implementing that phase. And that really, hopefully we made up some time here, or at least I'm finishing on time, Katie. I wanted to share where folks could go for more information. You can reach out to me on my email. You can also hop on our NOMS website and have a look there. That is where our launch sheet currently is published. We will be publishing all of our study materials there. All of our past reports are there. There's also another link to another NOMS email if you'd like to learn more. Please do have a look and reach out if you have questions. It is very helpful if everyone can help raise awareness for the study, improve our response rates, optimize our response rates, and that will help the study succeed. So with that, Katie, I suspect you'll want to march on, but I can stop sharing.
We do have a couple of minutes for questions, and I do know we have a couple. One question is, the start date is in August. How long does NASS have to do the data collection?
So the data collection window will last for 2 months minimum.
Okay, 2 months minimum.
Mm-hmm.
And
go ahead. No, go ahead.
And it's only NASS doing that component.
So the surveys themselves that we've designed and all of the letters that we have put together, They will be distributed to potential respondents through NAS. And so respondents will be able to complete that survey in a couple of different modes with NAS. They can complete it themselves on the website. They can mail it back in, and there is an option to do in-person or over the phone interviews. So yes, NAS is the administrator of that segment of this study. You're correct.
And it can only be folks that are in the NAS population, meaning that they have been counted in a NAS survey in the past.
Or have signed up to be counted in NAS. Yes.
Okay. And how do folks sign up to be counted in NAS?
There is a link in I believe it's our launch sheet. I will double check. But you can go to the NAS website, and we also have that link that directs people so that they can see what it is they need to do in order to first identify if they're already registered with NAS and or get registered. And I apologize, Katie. At this point in time, those that are on that list, given our data collection window begins August 1st, there's some cutoff basically as to when they, would stop adding to that list. So new folks who are interested in getting signed up, please get signed up. They may not enter into the sample for this study, but want to encourage everybody to still get signed up if they're interested.
And just as a note, the American Horse Council does have a link on their policy page about the NOM study. So just to put that plug out there. Any
Thank
other
you.
questions or comments? All right. Thank you, Dr. Short. We will now transition to the American Horse Council folks. Emily, I believe it's you. Emily Stearns with American Horse Council. Go ahead, Emily.
I'm here. So hello, everybody. Excuse me. I just wanted to give a couple updates. So one, we had the USDA APHIS stakeholder meeting last Thursday in DC. To give a little summary of it, there was pretty good turnout, or what we consider good turnout in terms of USDA staff in person. We had current acting administrator Kelly Moore and several of her staff. We also had Dudley Hoskins show up for a little bit. We also had what we felt like was really good stakeholder attendance this year. We had ended up kind of recruiting some new stakeholders who had not attended before, because our ultimate goal this round was not to give APHIS a checklist of every single thing that we need them to work on, because we can kind of do that at any point in time, right? But to really make sure they understood the genuine impact that their policies have and their regulations have on the industry and the industry's ability to conduct business. So we had stakeholders share their experiences with import-export and what that meant in terms of current limitations on import-export business activities. We also talked about issues with running horse shows and issues venues have, as well as basically how policies and regulations can impact not just the upper level competitions we have, but how it kind of all trickles down into larger industry impacts at the grassroots level, your 4-Hers, your pony clubbers, things like that, and how the vitality of the industry really relies on making sure that regulations and policies are written in a way that are functional and don't provide kind of disproportional impact on these kind of lower grassroots groups while we're trying to support these upper level competitors. Sorry. All in all, some good conversations. We are still waiting on typically what they do is send us a list of commitments that they're going to make based on our feedback for the year. That can take anywhere from 4 to 6 weeks. So we're happy to share it with this group once we have that. Our big request this year was any commitments they send us, if we could just have rough timelines attached to them. So in previous years, the commitments have just kind of been a bit vague, but we wanted to make sure that we had some sort of accountability in terms of the commitments we get from them, in terms of making sure that any updates to policy and regulations are done in a timely manner, especially when we have big competitions like the Olympics coming up. In the future, we're looking forward to maybe some alternative agendas in terms of these AVIS stakeholder meetings, having them make sure we're getting actionable items and deliverables coming out of them. But again, we felt like it was a successful conversation, and we're looking forward to the next one next year. Any questions on that before I move on to our conference? Great. Okay. So the American Horse Council Conference, I'm just going to share my screen real quick. Maybe it's going to cooperate. The American Horse Council Conference is in Washington, D.C. again this year. We are going from June 21st to June 24th. That Wednesday, June 24th, is our Hill Visit Day. So if we have any stakeholders, any attendees, any members, anyone at all coming to the conference that would like to be doing meetings on the Hill with their legislators, or I'm also happy to facilitate agency meetings with USDA or any other agencies, EPA, FDA, if we're thinking about screwworm stuff. We are happy to facilitate that for any attendees. We also keep an open invitation to any USDA staff that would like to attend. We are happy to provide them a complimentary registration. If you are looking to attend and spend the night, we have our room block. You can sign up on the website. We do caution people, if you are getting a room, please only use the link on our website for the room block. We had a couple phishing emails go out to folks with false links that were kind of scamming people into paying a higher fee. So please, if you would like to attend the conference, only book through here or contact us directly, and we're happy to help you. The website is horsecouncil.org. I will gladly share with Katie so she can share it around with everybody. And the other thing, I had put it in the chat, but just going back to what Diana had mentioned about NOMS, we had put a link. We put together a flyer with a QR code on where you can sign up for the NAS study. When we spoke with NAS, we were cautioned by them that there is a pretty big lead time between signing up and actually getting approved. So if you have issues signing up, or if people are trying to sign up and are worried, I would do it sooner rather than later. And Katie, I'm happy to share the flyer we had put together with you if you want to share it with the group. That is all I have, just kind of a quick and dirty. If anybody has any questions, you can also always email me at easterns@horsecouncil.org. I'll put it in the chat.
Hey, Emily, can you just give some highlights of some of the speakers so that folks get an idea of what the presentations may be at your annual meeting, as it's a different approach this year?
Yeah, absolutely. So we have a couple of really fantastic speakers. One of them I'm excited about is one of the NAD Prep grants going on right now. It's the Colorado State University grant that is working on identifying horse facilities using satellite imagery to get kind of a pseudo horse census that way. We have another intern project that's being presented that's been about a 4-month-long project on trade and tariff impact, and kind of looking at long-term trade within the industry over the last 25 years, looking at data. We have one on second careers for horses and what that looks like looking forward. We have another one on kill pen buyouts and scams associated with that. We have our standard United Horse Coalition Day panel They are doing a euthanasia and disposal panel. So euthanasia and disposal is a topic we've identified as a welfare issue for both the human aspect side of handling euthanasia and disposal and navigating euthanasia disposal, and looking at the issues associated with delayed euthanasia and the potentials for delayed euthanasia. For that panel, we will also be presenting some results from a large euthanasia and disposal survey we just conducted. We had 3,500 horse owners respond to a short survey we asked about their experiences accessing euthanasia and disposal. And just some real quick facts about that off the top of our head. Out of those 3,500 respondents in the United States, 20% do not have a euthanasia plan, end of life plan for their horse. Another 20-ish% could not afford a euthanasia if they had an emergency or a disposal if the horse died overnight. And then most concerningly, 15 to 20%, depending on the populations you look at, have delayed euthanasia because of the cost. So that is what's sparking our discussion to this topic as part of a welfare conversation. We're also looking at this one. Julie's really excited about this one. I think it's going to be a good one. Discussing the importance of equine science and animal science programs at the collegiate level and how that impacts the industry at large.
Thanks, Emily. Those are really great and diverse topics. And I know the tariffs and the euthanasias have been a very timely topic because we've had a lot of conversation recently over these topics and looking at the economy and impacts on the horse industry. And those are two big areas that we've actually explored in discussions. So hopefully we can get some information and resources together from this meeting. So thank you. Any
Yeah, you're welcome.
questions? Any questions for the American Horse Council folks? All right, hearing none. Thank you for your time, Emily. Now we're going to
Anytime.
turn it over to Dr. Josh Kloppel from the Equine Staff Veterinarian for the California Department of Food and Agriculture to speak about the equine infectious anemia cases and some of the interesting findings that they have going on in California. Josh? You're on mute. Oh, there you are.
Oh, had to click it a few times.
Go ahead.
All right, thanks, Katie. Hello, everybody. I'll just give a brief rundown of kind of what California has been dealing with the first 4.5 months of this year. It's been quite the EIA heavy response for us this year. To start the year, one of the ones I'll mention because it is on our public-facing website is a case that actually started in December. The horse was clinically ill and actually succumbed to the disease itself. The horse, just prior to passing, was tested and positive for EIA. That was actually, it died on Christmas Day. That was the first one that carried over into 2026, where one cohort horse on that prim was tested, but it was negative and has since been released from quarantine. And then early February, we had a 4-year-old mare that tested positive, getting ready to go out of state. Her background was that she was purchased at a public auction here in California from a private seller who sold her at that sale, and she ended up in just a backyard kind of boarding facility. There were 35 cohort horses there. All 35 were sampled and negative, and the 60-day, both initial test and 60-day, and that place was released. I'm running through those quickly because then it really is when our saturation within a very select demographic of the unsanctioned, what we call bush track or match race industry kind of took off at that point. Our first one was in California, we only announce positives based on counties. So in 2026 so far, it's been 7 counties. In Stanislaus County, we had 2 geldings that came up positive simultaneously from the same veterinarian on a premises. That led to 25 horses on site being tested And out of those 25, 13 of the on-site horses were confirmed positive. So on that prim alone, that was a total of 15 out of 27. 12 of that cohort still remain. The two original positives were euthanized, and then after the determined positive 13, they were also all euthanized. So 12 of that cohort remain in quarantine on site. The interesting part about this is this set off a couple of tests from concerned previous attendees of this training facility. And so we had an additional 3-year-old gelding that was submitted for testing to the same veterinarian, private veterinarian that did that 27 horse prim. And that was a true 1-horse prim, but that horse was positive and euthanized. This one is looking like it was reported as a plasma link. This one is a little less understood based on the information we were able to get from the epi, but so far that's looking like the reason. One specific note of interest is this exact same trainer and exact same premises has had EIA when Katie actually had my position in the past, and this person and premises had positives in 2012, 13, and 14 in consecutive years. So here in California, the lessons are learned kind of hard and don't carry much lasting power, evidently. After that, we had another one in Fresno, which was a single gelding with 3 other horses on site. Those 3 horses were all negative. This one's appearing to be a little bit of a one-off, but still linked to the unsanctioned quarter horse racing group. And then we proceeded into another one in Santa Clara and another Northern California one, and it was a single 5-year-old gelding positive, and it's looking like a separate group, but still within this same tight-knit unsanctioned quarter horse racing demographic, but a different connection epi-wise that we are still pursuing currently and actively. And then finally, our most current one, which grew quite the epi legs, was in San Bernardino County. In late April, we got a positive on a 4-year-old mare that was getting ready to leave town for training. She came up positive on a general interstate Coggins sample. When we traced this epi, we were kind of having a dead end. One thing about California is they've gotten pretty savvy as to our rules and regulations as far as quarantine goes. So if they think a test is taking too long, especially in this unsanctioned quarter horse racing realm, they will move the horse to an off-site location, and then they'll go, oh no, it's a single horse here. So our epi kind of takes on a different look at that point. Myself and my colleague Katie Hatch are constantly on the epi trail wherever we can, utilizing multiple platforms and modalities for that. We tend to do okay. Obviously, it's not a foolproof approach, but it's pretty successful most of the time. This one turned out to be where a person that had horses in the original barn had reached out to their private practitioner saying they were concerned for their horse's health and had their veterinarian pull Coggins samples on their own. That was made aware to me, and then the picture started to fall together, and then it was made aware where the home barn was. We were able to get into that barn, and there were 13 horses tested in that barn. 6 of the 13 were confirmed positive. The 7 remaining are on site, and the 6 are due to be euthanized soon. One thing about that one is this person, once we were on the scene, didn't hold back a whole lot of information, and so they let me know that 4 horses the week before we got there had left. They are still in the wind, and we are still trying to locate them. 3 of which were reported to be headed towards Mexico. If they crossed legitimately, it hasn't come up on our radar yet that they were detected. if they smuggled them across, obviously that would be fall through the cracks. And then the other one was said to be headed towards Florida. We made Joe aware of that, but the information we got was registered names, and so it's going to be a little bit of a shot in the dark, but just wanted to do our due diligence and give Joe the heads up that supposedly it was headed that way. And then so this led to a Riverside County where there were 2 out of 3 horses. The interesting thing about this outbreak is that it was said to be kind of bootleg plasma that this person purchased. It's sounding like a known plasma distributor's packaging is being replicated, and where they're getting this source, we're still working on that and investigating that, trying to get a little more info there. But it does seem like it's being passed off as legitimate, and then obviously seems to appear to be tainted. And so that's where we're at. I know I flew through that, but what I'll leave you with are kind of the raw numbers. So in 2026, CDFA has had 88 total horses tested for EIA investigation, not just in the state total, but for our direct investigations. Out of those 88, we have 29 positive. One thing we found interesting was if you pulled that 35 horse cohort, which was a known backyard boarding facility, so the needle sharing or the iatrogenic transfer was obviously a much smaller risk and normally not the ones where we see these. If you remove those 35, that leaves us with a total of 53 tested in a very targeted demographic, with 28 of those being positive, giving us a 53% positive rate. Some of the premises that are still in quarantine waiting on their 60-day, I am assuming we will get more positives with seroconversion. The way the on-farm treatment happened and the layout of the barns, the horses that were positive versus negative, I think the ones in between and their normal stalls were just in line to get all the same things that the positive horses got. So my hunch is that we will be seeing more true positives on the 60-day cohort rebleed. And with that, I think that's about all I got. I know I spoke really fast, so if there's questions or concerns, Katie can always share my contact info. I'm happy to discuss with anyone with questions.
Yeah, Josh, it's really a shame that the education is very short-lived, because I remember going to that premises in 2012, 2013, and 2014. And it's a shame that they have it again. And I would guarantee you will find more on that retest for the exact reasons. Did you test all of these for pyroplasmosis as well?
Yes, so CDFA's main or normal SOP procedure is on our original regulatory sample. We always pull a second sample and submit those for pyroplasmosis. All of these horses have all been negative. So kind of the opposite of what Colorado was seeing last I saw their presentation. It's really uncommon for us to see, I shouldn't say uncommon, but it's less common for us to see dual infection um, unless they've had a recent history or history of travel to and from Mexico. Otherwise, the ones we're seeing that are iatrogenic here in California seem to all be EIA exclusively and pyro negative.
That's interesting, because that is a transition over time, and that leads to your blood product probably just having EIA in it. So, as opposed
Correct.
to having 2 pathogens. We do have a question. What method of euthanasia did you use? If pentobarbital, did the owner pay for it?
Yeah, so in California, we actually don't cover the euthanasia or the disposal or haul off. So that is on the owner to arrange. But our requirements are that it does have to be a licensed, accredited California veterinarian, and the disposal pickup has to be by a professional company. All of these have been euthanized by barbiturates. they are marked with a B as required here in California, and the haul off accounts for that. So they arrange with either a landfill, if that's the route they're going, to be immediately, depth the whole waiting for the drop off, and then immediately back covered and all of that. But so far to date, all of these have been euthanized, other than the horse that died by its on its own in late December last year, which was kind of a one-off. But all of them have been euthanized with barbiturates by licensed California veterinarians.
And is the state staff required to be on site when the euthanasias occur for verification purposes?
Yes, so our requirement is a CDFA employee, usually it's a veterinarian, must witness the euthanasia and the pickup from the professional company. So once they're hauled off site, then CDFA sits on that quarantine for the time, and we'll do various check-ins. But we also verify the horse. We recertify that the horse, if it had a microchip, we rescan it. We match markings, tattoos, brands, any of the markings and descriptions on the confirmed positive Coggins that we pull. That is done at time of euthanasia. And then the veterinarian's given the green light to proceed, witness the euthanasia, and then get pictures of them pre-euthanasia and on the ground for our internal records.
Speaking of identification, Josh, there has been rumors out there that these horses are getting a little smarter, or the owners are, and not identifying them with microchips, brands, or tattoos anymore. Do you have any background on that?
Yeah, so one of the things that we've been made aware of is within this unsanctioned race world, the advertisements or the call for entries, some of the races, not all of them, but some of the races, they are specifically requesting excuse me, unmarked, unidentified, professionally identified horses to be the ones that compete in that race. Through my different avenues of trying to figure out why that is, if that's a direct response to us and the recent uptick in positives that we're seeing. I haven't gotten a definitive answer on that, or if it's just that that's something within their world they're trying to move towards. I'm sure it has something to do with lacking traceability in these situations where these barns, half of a barn is getting wiped out or more. And in recent years, this isn't the first time we've seen this, but this year it definitely has the highest percentage of positives. But we are seeing and hearing that is being pushed and promoted within that world. So we'll see what the ripple effect of that is. And that information is still kind of pending as to the reason or purpose for that.
That is definitely concerning that we have lack of traceability in this population, specifically the population that's a high risk for disease. They're using products that are probably not sanctioned as well and coming across the border illegally. So a lot of risk factors and challenges that are ahead of us.
One of our biggest hurdles here, which is really hard here in California. I don't know how the rest of the listeners feel in their states, but California has a really tough issue with unlicensed foreign veterinarians who have, an in these communities, and they're much more trusted. And so the products, the treatments, the all of those things are really hard for us to get a handle on, because our licensed veterinarians here are really in tune with us. We have a really good working relationship with most of our California equine veterinarians. And so we're made aware of concerns that they have. But so much of this is done by off the books, unlicensed foreign veterinarians that's a tough part of our gig here in California, chasing that down as well, because that's a huge risk point that's happening here as well.
Yeah, that is a challenge. We have about 1 more minute. Are there any other questions? Thanks, Josh, for that overview.
Yep.
Any other questions, comments, or concerns for any of our speakers? Okay, hearing none, I thank you for your time today and look forward to you next month on June 11th. Same Zoom call link. I will send this recording to the EDCC website within a week. Thank you to our speakers. I appreciate everybody's time today. Have a great day. Thank you.